And joining me now is Harry Quilter-Pinner, Senior Research Fellow at the Institute for Public Policy Research, where he heads the Health and Better Care programme. Harry, thank you very much for coming along. Pleasure. The Royal College of Nursing talking about corridor care becoming the new norm. In a survey they've done, they talk about 49% of their respondents say the term corridor nursing is formally used in their workplace. Is it the new norm as far as you're concerned?
I think increasingly it is, yes. I mean, this has been one of the worst performances for A&E and access times on record. And I think particularly concerning is actually the numbers we're seeing in the summer months. So last summer, the performance we saw was equivalent to previous winters. Now, what that's suggesting is that we're in a permanent winter crisis in the NHS.
Yes, because we talk about winter pressures a lot, don't we? But that more and more is becoming the pattern. That pressure is seen right through the year, not just in the coldest months.
Exactly, and what that's suggesting to us is that there's a kind of structural, systematic mismatch between the amount of demand, the number of people who need care, and the capacity of the NHS to provide that care in a timely manner. What
difference is that making to the quality of care, do you think, and to the stress placed on healthcare professionals, nurses, doctors?
So, I mean, overall what we've seen is that outcomes for most areas of care have been improving over the last decade, but access has deteriorated. So people's level of stress, the amount of time they're waiting in corridors has got a lot worse.
And to get out of ambulances into A&E as well, we've seen from these latest figures, pretty bad.
Exactly, and you make the point about nurses. I think when you speak to staff, what they say is that it's getting harder and harder to deliver the care they want to give, and they feel increasingly under pressure. And the problem is that's a self-fulfilling crisis, because nurses and doctors then say, do you know what, I don't want to work full-time, I don't want to work in these conditions. They leave the sector, and we have an even bigger crisis. The capacity problem gets worse.
The College of Nursing, the Royal College of Nursing, is talking about a need for an in-depth examination of the primary care sector, of creating more of what they call a neighbourhood NHS with more focus on GPs, pharmacies and so on. You talk about structural problems. Is that where the answer lies?
So there are two parts, I think, to the solution, two priorities that we would say. The first is exactly as you've mentioned, the primary care crisis. If you can't see a GP, then you're likely to turn up at A&E instead, and we know that patients are doing that. Particularly if you've got long-term condition, if you're not supported by your GP, by the team of professionals around the GP to look after yourself properly in the community, you know, long-term care plans, support in the community, then you will end up ending up in A&E. So certainly part of it is about us dealing with that better in the community.
Yes, people who shouldn't be in hospital ending up in hospital because of issues with the primary care sector.
Mismanaged care, essentially.
And the second point?
The second point is about discharge. So what we've seen is the length of stay in hospital go up. So once you're in hospital, people are staying in hospital for longer. And the root cause of that is that there's not enough capacity in the community sector and in the social care system to move people out of hospital when they're ready to go. So we've got a survey done by Carnot Farrow consultancy firm shows that 30% of beds in some acute hospitals are taken up by people that are medically fit. They could be in the community, they could be back in their home, but unless we can put a package of care around them, support them with the social care system, for example, we can't discharge them from hospital. And that's creating problems when you're trying to move people into hospital through A&E.
So you have this image then of hospitals trying to deal with patients who are, shall we call them, medically unfit, but being squeezed at either end.
Yeah, exactly. And so what we really need is investment and reform in both primary care to prevent people turning up at A&E in the first place, but also more investment in capacity in social care so we can help people move back into the community when they're ready.
A key question in all of this, and finally, Harry, is what the government's saying about its plans for the NHS, social care and so on, in any way matching what that sector says is needed.
So I think we have what's called the NHS long-term plan, which has been put together by the NHS and the government, which is a very good plan. It sets out all of the measures we've just talked about. There's a big question about whether they can deliver that, and in particular the workforce constraints about whether they can recruit enough staff to deliver that. And then on social care, we've had decades of promises to solve the social care problem, to get a proper long-term funding settlement, and we still haven't got a solution. The government have committed to cross-party talks. They've said that they want to make this a priority, but we've heard this before from a succession of governments, and until we get real evidence that there'll be more money put into social care and a long-term solution, we will not solve this problem.
Okay, Harry, good to talk to you. Harry Quilter-Pinner, Senior Research Fellow at the Institute for Public Policy Research. Thank you very much.
Thank you.